And Dr. Turkey, take it away. Thanks very much.
Okay, I'll let Sarah go first.
Okay, super.
Well, hi, everyone. Thank you for joining us. My name is Sarah Campos, and I am the university recruiter for the College of Dental Medicine here at WesternU. And we're really excited to have your club here and hopefully share more about all the opportunities within the dental profession and what makes our program unique. We are honored to have Dr. Turchi here with us. He is the Assistant Dean of Admissions and Recruitment. He is also the coordinator of continuing education and assistant professor for the College of Dental Medicine. And Dr. Turchi has dedicated his career to supporting our students and their journey to dentistry, both in and out of the classroom. And he brings a wealth of knowledge about the admissions process and as well as the profession as a whole. So, Dr. Turchi.
Yeah, well, thank you, Sarah, very much. Sarah and I do a lot of these meetings together, and I was shaking my head this morning because I thought, how in the world have we never talked to UCSB before? It's crazy to me because we actually, our top feeder schools every year are UCI, UCLA, UC San Diego. And so we get so many UC kids because you're very bright. We know that. You're hardworking and you're smart kids. So I'm really happy that we can maybe open this up and you guys to learn something about us because we know a lot about you already, like I said. So just a little bit about me. So I went to UCLA undergrad. I was non-traditional. I actually got a liberal arts degree. I got a history degree. And then I ended up going to dental school at University Pacific up in San Francisco. I practiced for about 19 years. I then worked as a consultant for a dental manufacturer. And now I've been in dental education for about, I guess about 14 years, 12 of those here at Western. And I really enjoy this. I was going to be a teacher originally, and here I end up working in an academic institution. So I guess we all end up where we're supposed to if we just allow life to happen and have an open mind about things. The one thing I would say before anything else, and I want to give you as much information as I can about our program, because I do think it's unique. But even before that, I really want you to do your homework about dentistry. So before you decide which schools you want to apply to, go to, really make sure you want to be a dentist because dental school is hard. I don't want anyone that has great grades and a great DAT to show up here and then just say, I hate this. I might be smart, but I really don't like what this is involving. So the thing that you can really do for yourself more than anything is make sure you spend time in a dental office, do the shadowing, do the assisting if you can become a dental assistant, but just know what you're getting into because that's how a history major can get in and out of dental school because I was really aware of what I was getting into. I was a little bit older and I was very focused. And that's, I'm telling you, more important than high GPA. There are plenty of students who have come here, non-traditionals, pretty average GPAs, DATs, but they're so focused and they're so clear about what they want to do because it sounds like a joke, but I always say you guys think it's hard to get into dental school, but if you ask our students, they will tell you it's harder to get out once you're in. So if you make sure it's what you want to do, and if you're sure, I'll help you as much as I can. And I don't even mean in terms of talking you into coming to our school. If you have questions about dentistry, other dental schools, I'll be happy to share that with you because at the end of the day, I have 4 daughters. I don't talk them into anything. So, but if something they're interested in, yeah, I'm happy to help. It's no good to try to sell somebody on something. I'm just going to tell you who we are, what we do, and if it appeals to you, then when you're applying someday, then you might want to consider it. Now, I do have kind of a lot of information to share with you, and I'll try to go through at a reasonable pace so you don't get sick of me talking. Because that's
And just for context, Doc, most of these students here are current applicants, just so you know kind of who your population is here.
good. I appreciate that. So this might actually take a lot of, for those of you who may have applied to our school, we're just starting to invite people for interview. We'll be interviewing through September, October, November, January, and February. So we have a lot of interviews yet to go. And we're still getting a lot of applications every day. So it's just the beginning, really, for this cycle. Okay, thank you for that information. I am going to try to share my screen. I still never understand how this actually works. We've been doing this since COVID. Let me see if I can get to my PowerPoint. I know it's here somewhere. There it is. Okay. Seems like magic to me still. Okay. All right. So you guys can see that okay.
Sure can.
Okay, great. Thank you. I know everybody's waiting for someone else to do it. So anyway, this is one of our main buildings on campus. If you came for an interview, you would walk through those glass doors there on the first floor and check in. This is what's called the Health Education Center. So our dental school opened in 2009. First graduating class was 2013. Back then, this building didn't even exist. So it's a relatively new building. In here is a lot of faculty offices, lecture halls, most importantly for dental students, the simulation lab, which I'll show you some pictures in just a couple of minutes. So again, there I am. That's me. Feel free to contact me anytime. And there's Sarah and her job title as well. All right. So this university opened originally as the College of Osteopathic Medicine of the Pacific, 1977. If you're not familiar with what osteopathic medicine is, you should look it up. But it's somewhat slightly different than traditional medicine. But when they graduate, they have all the same rights and privileges as an MD. So they'll get a degree called a DO, Doctor of Osteopathy. Maybe some of you already know that. Maybe some of you don't. I didn't know that till several years ago. I didn't really know the difference. So anyway, that was the very first college. There's now 8 colleges here at Western and 27 degree programs. These are all the colleges there. Those 2 at the top have the number 2 after them because they also have sister campuses in Oregon as well. So a lot of different healthcare, all graduate. They're either master's degrees or doctoral degrees. Okay, so I want to tell you a little bit about our curriculum because I got into dental school. I didn't ask a lot of questions. I just thought they must know what I need. So I'm just going to do what they say, and it all worked out. They did know what I need. But I think it's important to explain this road that you're going to be on and why you're doing what you're doing. So if you look at those 2 blocks up at the top, the basic and biomedical sciences and what we like to call ECD, Essentials of Clinical Dentistry, that's mostly what you're going to be doing in the simulation lab, the hands-on. So you see those letters underneath INBDE. If you're familiar with that, great. It's the Integrated National Board Dental Exam. It's a written exam that everyone who goes to dental school anywhere has got to take and pass to be eligible to graduate. So you don't pass this, you cannot get your diploma. So I want to talk about those a little bit first, those 2, because you need to be able to pass this written test. You take it during your 3rd year of dental school. So this is it. This is the study guide in case you get to that point. So anyway, so this is our simulation lab, and this is where you're going to be learning a lot of the information for that integrated national board exam. Now, the thing I think is good, this integrated board is only a few years old. I think they've only been doing it for 4 years. And they used to give you exams on 2 separate occasions, but they were all broken down into all the science courses and then all into the dental sciences as well. I think it makes sense to what they're doing now. It's not one test, but instead of asking you anatomy questions and then asking other questions, they're going to give you like a patient and say, this person is here today for this type of filling on this tooth. What kind of anesthesia you're going to use based on their health history? What anatomical landmarks are you looking for? What is the anesthetic you're going to use for them? So you're getting dental and then anatomy and pharmacology questions all within the same basis of how you really need to know it as a practicing dentist or a dental student. The thing about it, we've been teaching it like that from day one. So all of the basic science courses that you take are all integrated into what you really need to know when you do patient care. So your first 2 years, you're taking all these classes to really prepare you to jump into the clinic in your 3rd year and really understand what you're doing. So, but you got to learn the hand skills. So again, this is the sim lab. if you look at that picture on the lower right, I really like this picture because actually this was my group I was working with at the time. If you look, it really does simulate real patient care. They're wearing gloves, they're wearing masks, they're wearing goggles, they're wearing loops, the magnification. And they're even the ergonomics that we work with them. We want them to take care of themselves physically. So everything is real except for their little patient there, which says, plastic teeth, but it also has lips and cheeks and a tongue. So we're trying to get you as ready as possible for the clinic. I think one of the most important things that we do is what we call self-assessment. So before they ever do any project, they will fill out this little, they'll have this little roadmap, a little rubric. And so as they go along, they're scoring themselves about different parts of this preparation they're doing. And then they switch seats and they'll score each other's. And then they'll have me sit down and I also score them. So the nice part is, I think, is that for every project they do, they get to look at two. And it's not competitive or uncomfortable. I mean, it's a really collegial thing. And so they can really learn from each other. And so they get to look at two every time they do one. And after a very short time, I would sit down and I wasn't changing any of their scores because they got very good very quickly at looking at their own work and critically and being able to know, is this going to work? Is it not going to work? What have you. So that's a very important thing to know. So our students actually get these hand pieces in their hands the second week of first year. The first week of first year, they're in the sim lab, but they're unpacking all their equipment and learning what each part of that does. But right away, we get them with that handpiece. We want them to start doing this work immediately. There's no reason to wait. So yeah, there are some tests. We want to make sure they're competent before we send them over to the clinic. But if you look at the very bottom block there, the dental center and community-based care, that's going to be their actual patient care, real patient care, whether it's here on campus in the dental center or when they're doing rotations out in community clinics as well. So everything that they're taught along the way is always to get them prepared to do safe patient care. That's the point of everything we do. Okay, so first 2 years, of course, all the biomedical sciences. And it's funny because none of these are on the DAT, but these are the ones you need to know for dentistry. So you can take anatomy and pharmacology, micro, oral path, very important, biochemistry, physiology, and a lot more. So this is a huge part of your first 2 years is taking these and then learning the systems as well, cardio, blood, lymph, everything. It's very important so you can actually take care of a human being. Okay, so now let's look at these bottom two. So now this is going to be really in your third and fourth year, where you're doing what we call comprehensive patient care in the clinic. That's our clinic here on campus. I'll show you a couple pictures in a minute. And then also they're going to be doing outside rotations and working in local community clinics as well. That's a big part of our curriculum. And it's such a nice thing because it's such a win-win. Our students are getting more work, but they're typically working on patients that don't normally have access to care. So it's just, like I said, such a win-win for everybody. And our students get a lot of extra work outside taking care of people. Okay, so, oh, I forgot about that. So if you look at the bottom there, licensure exam. Okay, so there's a few big hoops you got to jump through to be able to actually start working as a practicing dentist. So get into school, you got to pass that written integrated board test. You've got to graduate, and then you got to pass this licensing exam. So what this is called now is called the ADEX. And I think you guys are at a real benefit now. It used to be you would take the test for one state only. If you wanted to work in California, you took the California board and you had to get 3 actual human being patients that would qualify to show these skills. And it was very difficult to do. And if you didn't pass, you had to wait 6 months to take it again. So it was a lot of stress. So what we're doing now is something called ADEX. And ADEX is a benchtop non-human being test where you're going to be doing the work on the same little typodons you were using in your first 2 years of dental school. These are the different disciplines you're going to be tested on. And if you pass this exam, then you're eligible to get your license. But this is the nice part about it, the portable word. What does that actually mean? So you take this ADEX exam here at school, And then you'll graduate in just a couple of weeks after that when you pass. And then you can go practice anywhere except New York and Delaware. So if you want to go to New York State, you have to do a 1-year residency program. That's how you get your license. Delaware, I'm not sure what's going on there. But for the rest of the states in the US, you pass that ADEX, you can go anywhere you want. You apply for a license. At that point, you're just writing checks and you get a license and you can practice anywhere. So it really opens up more possibilities for graduates now than when I graduated. When I graduated, like I said, you didn't have a lot of choices. You just kind of state by state. So this is something that we prepare our students to be able to take and pass. Okay, so let's look at the clinic a little bit here. That's our building. It's across the street from that first building I showed you, the Health Education Center. This is called the PCC, the Patient Care Center. That top floor, all the way front to back, is called the TDC, the Dental Center. And it's interesting, if you look again at this picture on the lower right, it looks a lot like what they were doing in the simulation lab, right? So it's exactly what we're training you guys for. Okay, so let's talk about that program. So of course, as a dental student, you're all going to be general dentists. So you're all learning how to be a general dentist. There'll be 4 groups in the clinic, and they're actually the same groups you were in your first 2 years in the sim lab too. So you're in that same group all 4 years. There's usually about 23 people per group in the clinic, and there's 4 general dentists per group. And these are the faculty that are there to get you start checks, to get you checks through in the middle, and to get you a finish check so that you can finish up. This 6-to-1 ratio, you might find if you look around at other schools, is really good. The reason that's important is that as a dental student, you're doing everything kind of on the slow side anyway, because you're learning. So if you bring your patient in and you want to get started and say, this is what we're doing today, you can't do anything until the faculty sits down and says, okay, go ahead. So if you have a long line of people that you're waiting for, you're already slow to start with because you're a beginner. And if you have to wait 45 minutes to get started, it really cuts into that whole afternoon or morning session. So we want to get you guys started. That's why we have more faculties per student than a lot of places, so that we can actually get you working. We don't want you to sit and wait, and the patients don't like that either. So procedure competency assessment, what does that mean? So when I went to school, and at a lot of other schools even now, to graduate, you have to do X amount of every procedure. Like you have to do 100 quadrants of root planing, 50 fillings, 20 crowns, et cetera, et cetera. The problem with that is that then our students start looking at our patients as procedures and requirements instead of people. And we don't want to do that. We don't want to see them trading a root canal for a partial denture, because that's what each student needs, like their baseball cards. So instead, for all these different procedures, there's 10 or 11 of them, we want to make sure you show you're competent at least one time. And it gets a lot of the pressure away from our students, and they know that they only have to do it once each. But because they're doing comprehensive patient care, that means they're going to do everything that patient needs anyway. And it puts the patient back in the center where they should be, the most important part. Practice management rotations, that means you're also going to work in every part of the clinic, so you know how the whole thing works. It's really just a giant group practice. So there's the people doing scheduling, the people doing insurance billing, people doing sterilization. You're going to do all those things while you're there too, so you understand how the whole thing works, not just how to do the dental procedures. Okay, so this is a big part of our curriculum and a big part of our culture as a school, is that we're really ingrained in doing community-based dental education. And what does that mean? So in the 3rd and 4th year, our students will go out of school for 7 weeks. They don't come to school at all. They'll go to a particular clinic and they just work there for 7 weeks. They go to work every day, and they're going to see 6, 8, 10 patients a day instead of 2, like every dental school. Once again, it's also helping people that don't normally have access to care. This is one of our rotation sites. It's actually in Rancho Mirage, out in the desert. Excuse me. And this is a place that 6 of our students will go at a time. But we have a lot of other locations as well. but it really gives our students so much more experience while they're doing good for people. You're going to do part of this community-based dentistry all 4 years. Even in your first and second year, like one afternoon a week, you're going to go to a local clinic around here, and your first year, you're just going to do assisting or hygiene instruction. It's going to be a lot of little kids that have never even seen a dentist before. But by the end of your second year, you're going to start doing whatever they need, whether it's a filling, a cleaning, what have you. And then again, like I said, in third and fourth year, you're just gone for 7 weeks and you're just getting a ton of experience. Okay, also interprofessional education. Why was that in the middle all this time? So in your first 2 years, you're going to spend a few afternoons a week where you meet with all these people from all those other colleges, and you're going to be presented with a particular case about patient or patients, or even sometimes it's animals, because we have a vet program here. And it's really interesting because they're real cases. And you get in there and you start to hear how all these other professionals are looking at patients from their points of view. And it really opens your mind as you're a dental student or a dentist, because I've been in there too listening, and I just thought, man, I would have never thought of what the vet or the pharmacy student might have said, because it's just bringing all this knowledge in together, and everybody's kind of contributing to this. It's really interesting, but we really want to open your minds that we're not just tooth technicians where we drill and fill. We want to really treat the whole patient, and if you're not thinking about all these other disciplines, you're going to be missing out. You're not going to really be taking care of the whole patient, which is very important to us. Okay, so I want to talk, we do all this community dentistry and all, but we have this other side to our personality where we really are into everything that's considered very high tech, but proven and tested, obviously. So our students, from even first year students, will learn how to do CAD/CAM dentistry. And what that means is they cut a preparation on a tooth, and these students are scanning that image of that tooth into the laptop. They're going to then design the restoration on the laptop, and then they're going to have it made. And this all happens in about 20 minutes. So this can replace a procedure where you would put, say, a temporary crown on a tooth and then take an impression. They got to come back in 2 weeks and you try the crown on. We still do that. We're still taught that, but we teach this as well. Can all be done in one day. So this is what it looks like. The laptop, that blue tooth is what they've designed to restore that tooth with. And the little scanner there is what they scanned it in with. And they hit a button and it goes to this milling machine in the back there. And it starts out like this porcelain block. And after they told the milling machine what to do, it looks like that. I mean, talk about magic. It still blows my mind, but this is what it does. And this is what our students are learning. Part of it is we want them to be able to have these experiences. So when they get out of school, most of them are going to work as employee dentists for an owner somewhere. And if they're doing CAD/CAM, we want our students to be able to say, yeah, well, I already know how to do that. I don't need to be trained on that. Because if you're interviewing for a job as an employee dentist, you want to have as many tools to sell them on you, to say, hey, this person can actually contribute more to our office. So that's one of the things we teach. This machine, if you've been in a dental office, you've probably seen it. It'll take these two images. That word digital, very important. Digital x-rays, much less radiation to the patient. So we only do digital x-rays. Plus the x-rays are more clear. So that U-shaped tube that's attached to the pole takes that image on the bottom, the panoramic x-ray. That arm that sticks out to the left takes its cephalometric x-ray as well. That kind of shows the whole head. If you had orthodontics as a kid, you had a couple of those taken for sure. Now, this machine will do something else as well. It will take a three-dimensional or a cone beam image. And these are the three fields of view, just to demonstrate that. It's not what our images look like, but it shows you the different angles that it's being taken from. So if you look at this here, that image on the top left, we're looking straight down on a tooth rather than from the side. The image on the bottom left, we're looking from the front of the face to the back. And on the bottom, we're looking from basically ear to ear. Now, you might say, well, okay, that's nice, but this information is already in the computer, the patient's long gone, but you can scroll up and down, back and forth, side to side with this cube of image there. And this is a perfect case. Excuse me, if you look at the tooth on the bottom left, you might see it's got a crack going across. Regular x-rays wouldn't show us this. This tooth just hurt the biting. We didn't know what was wrong with it. But once we took this cone beam, we saw, oh, well, the tooth is broken in half and just being held together by the gums. And so this tooth had to be extracted. But it really serves so many purposes for us, placing implants into the bone, doing root canals, where we really need that third dimension that we wouldn't typically see. And that machine that you saw, I mean, it's on the clinic floor. We use it as needed. Okay, we also have something called Overjet. This is something that we would call a clinical decision support tool. So it's not doing the work for us. It's just helping us identify things that we're seeing on x-rays. So again, one other thing you can do with it, you can show patients things as well. So this is what that looks like. Whatever you see in blue is metal, either it's a gold crown or a silver filling. You see these red and yellow lines. It's showing if there's been bone loss. So the red lines are showing, hey, there's been a little bit of excessive bone loss here. So we want to keep an eye on that. You see the one green one, it's very short line, 0.9, very little bone loss. So it's kind of like a traffic signal, green, yellow, red. But it helps us to see everything we want to see. Anything you see in red that's on the tooth is an area that's possibly decay. So we're using this on our patients as well. We're one of only 2 dental schools that are using this right now. It's something that's really brand new technology, but it's very helpful and we're using it. Okay, so let's get down to business here, even though a lot of you have already applied. These are our numbers. So we get about 3,000 applications every year. We interview 320. There's our average academics as well, science GPA. We don't look at overall GPA, just science, and then those are the average scores on the DAT. Now, the funny thing is when we open an application and start looking at it, these are the first 2 things that show up as you're going through the application. And sometimes these GPA and the DAT are just off the charts great. And it's like, that's good. But then I think, okay, well, what else? So I'm going to tell you in a minute what we actually look at. But let's look at these dates. I think most of you guys already know this stuff if you've applied. DAT has to be taken by December 1st. Supplemental application is on our website. Even though the ADSAS will take your application until February 13th, we need to have it by December 1st, the supplemental. So you got 6 months basically to do it. So those are what our individual dates are. I'm sure you guys have already done all this stuff. These are our prereqs. Something that's interesting to know, and maybe you found this out, is there are some schools that are requiring other courses. Now, these are courses that we would recommend that have them just to help you when you're in. I mean, it's not so much to get in, but to help you when you're in, because these are all courses you're going to take when you're in dental school. These 2, biochem and microbiology, are actually requirements for some schools now. So if you haven't applied yet and you're going to apply, make sure that you have all the prereqs that school is requiring, because if you submit and give them the $150 or whatever it is, and they say you don't have all the prereqs, they're not going to give you your money back. So make sure that you've met all their requirements, and it's easy now on the internet, obviously.
Now, before you proceed on this point,
Yeah.
Dr. Turchi, and I appreciate you bringing this out, would a student, I mean, I know this is, you're talking kind of in the abstract, some schools, but, like if you were on an AdCom for a school that required something like this, would you not still give that applicant fair consideration with the presumption that they're going to have to take micro, for example, prior to matriculation or risk rescission of their offer of acceptance?
Yeah, absolutely. That's a great question. And we look at a lot of applications that have these courses in progress, the ones for us. So as long as it's in progress, they can interview, they can even get accepted. But if they don't get a C or better in those prereq courses, their offer would get rescinded. Now, these other schools that are requiring these, I don't want to speak for them, but my guess it would be the same, that they need to be in progress, and if they don't complete them, because these are like these other schools now, they're like hard requirements. It's like it's not, like we want you to take biochem. I mean, you have to do it.
Yeah, I just think of students who are trying to apply without a gap year, for example, as rising
Yeah,
seniors. That
yeah,
that may be in progress, right?
yeah, for sure.
Got it.
As,
And as long
and
as
they
we,
must, oh, sorry about that.
no, I
And
was
they
gonna
must
say,
be
no, go ahead. You go.
they must be completed by the spring term prior to matriculation. So for applicants for this cycle, all of these prerequisites must be completed by spring 2026.
Got
Yeah,
it. Thanks.
it can't be taken in the summer. It would have to be in the spring, like Sarah said.
Okay.
But you're given opportunity on the ADSIS application to put courses in progress. So we will definitely see them. Actually, to be honest with you, when I say we, I mean at the dental school, if they're not in progress or taken, we won't even see the applications, because the admissions office at the university won't even forward them to us if they don't see all the prereqs taken or in progress. So that's why, like, by the time I see them, they're going to be there for sure, one way or the other.
Got it. Thank you.
No, you're welcome. Good. Thank you for that question. DAT is good for 3 years, just so you know. Oh, prereqs have no expiration date. So there you go on that one. So we do this, like a lot of schools, what they call rolling admission. So again, we're going to start interviewing September, October, November. So 5. Oh, excuse me, I've been talking too much today. 5, and then we'll start accepting students December 15th. Now, when I say December 15th, that's the first time any dental school can accept students. So after 5 interviews, we'll start making phone calls on December 15th and start filling the class. Now, with that being said, we still have January, February interviews, and we'll still be accepting students after that as well. Our class will not be full with the first group that we accept. But yeah, so if you can submit earlier, you might get interviewed earlier, you might be accepted earlier, but it's not the end of the world if you don't. Okay, so we have a couple admissions counselors that are happy to talk about anything with the mechanics of your application, as my letters of rec shown up, my new DAT score, any of that kind of stuff, or you wanted a counseling appointment. These are the two that are happy to help you. And this is all on our website too, if you don't get it. Oh, plus you're recording it, so that's good. So these two are very helpful. Actually, Sarah can answer all these questions as well. She used to be admissions counselor, and then she was a hybrid admissions counselor and recruiter. And now, thankfully, she only gets to do the recruiting because it was a lot of work. But Sarah knows everything as well. Okay, so I'm going to tell you exactly how we review our applications. And every school is different. And I was at UCLA Dental School for a couple of years before I came here, and I did some interviewing. I did look at applications, and they do it different than us, for example. So when we look at an application, we're going to score, you might guess from what you're seeing here, we're looking for balance. I was kind of alluding to that a minute ago with the super high academics. Sometimes that means all they did was study and they didn't do anything else, which for us is not a good thing. For some schools, probably fine. So what we're looking at, again, science GPA, DAT, how many hours have you been around dentistry? That was the first thing I told you guys, because I want you guys to come to dental school knowing what you're getting into and saying, yeah, let's do it. And that's so helpful. We score your personal statement on the ADSAS application. We look at the letters of recommendation. For our school, it's 2 science professors and 1 dentist. The third one could also be a science professor, but I always feel like if you don't have at least 1 dentist that you could ask for a letter of rec, you probably haven't been in enough dental offices, because usually dentists are very happy to write these letters, because usually people come in and say, I hate being here. And when someone comes in and said, hey, I think I'm about going to dental school, they get very excited. I used to, for sure. So that one, I would say, should be the easiest of all of them. And then we have a supplemental application. And at the end of the supplemental application, there's 4 prompts. The first one says, if you had any ups and downs during your undergrad academic career, something happened, family member got sick, or you broke your arm, or something happened, you can explain it. The second and third ones you can ignore because they ask about your dental hours and your volunteering, because we already know that from the ADSAS. The fourth question is actually what we score, and it says, why Western? So for you guys, if you apply in the future, any of you, if you don't, if you apply to Western, take what you learned today or anything you learn in the future. That's the kind of stuff we're looking for, very specific. Feel free to put my name in there, put Sarah's name in there. Say, hey, I go to UCSB and we did this Zoom meeting and I really liked XYZ about the school. That's only for us. We're looking for very specific information. Okay, and there's our emails. Again, we're always happy to answer questions, and I'm not kidding. I have a good working knowledge of at least half a dozen dental schools, and I'd be happy to tell you what I know about them. At the end of the day, if you want to be a dentist, I want you guys to go to the school that's the best fit for you. I mean, like I said, why would I talk anybody into coming here if that's not where they want it to be? And we're not a fit for everybody, but that's the key for you guys, and you're doing part of it right now is doing your due diligence to say, which one of these schools looks like the best one for me? We're very clinically based. I will say one more thing, and I think is so important because it's what I experienced in dental school too. So when I went to University Pacific, there was no specialty residency programs there. So everybody there was a pre-grad dental student. We got to do everything. If you got in trouble, faculty would jump in and help you out, but you got so much experience. We don't have any residency programs here, and our students are experiencing the same thing. My opinion, although I lived through it myself, schools that have residency programs, whether it's for endodontics or orthodontics or perio or whatever it is, those students you're going to have to share those patients with those residents as well. And usually the residents are being paid stipends, so they want those students to do work to cover their expenses. So it could be a little more difficult to get the same level of clinical experience at a school where there are residency programs. And I'll officially say that's my opinion. So there you go. I try to separate my opinion from facts. Average GPA is what it is. This is my opinion. Okay. So anyway, if you haven't been on this website, you should. There's so much awesome information, adia.org, especially if you go to something called Go Dental, tons of information in there. Okay, I really appreciate you guys having us come. I haven't been to Santa Barbara in years. I really need to make a trip. But this is as good as it's going to get for now, I guess.
Well, Dr. Turchi, this has been an amazing presentation. I'm going to stop the recording in a moment because I know, at least I'm hoping, if kids have worked with me before, they know not to let an opportunity like this pass them by. So they're going to be asking y'all questions. But I did have a student who got called in to work at his endodontist practice this afternoon, and he asked if I would ask this question. And I'm not sure if it's maybe their DO program. He asks, Western U's emphasis on community-based care led me to find the club Inland Empire Outreach, which mentions connections with physicians. His student is from the IE, and he said, I've noticed many people lack access to dental care due to the area's medically underserved status. Is it possible to include dental outreach to these medically underserved communities through this club? And I mean, you talked about community engagement, but I don't know if there are specific clubs that do the sort of thing the student is addressing here.
I would have that student email me and I can connect him with our associate dean for community dentistry.
Great.
And this is exactly what they do.
Okay.
And we might even establish a relationship with them so we could even send our students there as well.
Great. Super.
Yeah.
I will absolutely communicate. He'll watch this in playback, so I appreciate the answer. He asked me a couple of other things as well, and I think you covered that, stuff in the meat of your presentation. So students, raise your hand. That helps me kind of manage the workflow here. If you've got questions either for Sarah or Dr. Turchi, this is your opportunity to ask a question. Do not feel bashful. I see Aiden looks like he's looking for the raise hand button. Aiden, I'm going to take that. I'm either calling you out or I'm going to take that as me anticipating your question. So why don't you get the ball rolling,
Hey,
Aiden?
David, you know what? You said one thing that triggered something in my mind.
Yeah.
That you said he's at an endodontic office. So if you're doing your shadowing, make sure you do the majority of it with a general dentist. So sometimes I see somebody that's got 10,000 hours, but it's all in an orthodontic office. It's like, well, you're not going to do orthodontics when you come here. So it's a very different world than the general dentist lives in. There's no anesthesia, there's no blood, we hope. There's, no handpiece really. So it's okay to visit with the other specialists, but the majority should be with GP.
Yeah, most of my kids, they do DA with general dentistry,
Yeah,
chair-side assist sort of stuff, but occasionally they'll move, into getting maybe more specialized.
no,
I'll
that's
stop the
great.
recording
That's great.
now. And Aiden, I hope I haven't flushed you out, but feel free to fire away.